Welcome to another episode of our podcast, where we delve into various dimensions of mental health and therapy. Today, we have a special episode that serves as a companion to the course titled 3 CE Hours Therapy Modalities offered by Therapy Trainings. If you're a mental health professional, counselor, or therapist, you're in for a treat. In this episode, we'll summarize key points from the course, provide additional insights, and tackle some common misconceptions about therapy modalities. By the end, you'll have a richer understanding of these therapeutic approaches and how you can apply them in your practice. Let's kick things off by defining what we mean by therapy modalities. Simply put, these are different methods or techniques that therapists use to assist clients in overcoming their challenges. Each modality has its unique philosophy, techniques, and applications, and understanding them can significantly enhance your clinical toolkit. In Therapy Trainings course, we explore 3 primary modalities: cognitive behavioral therapy, dialectical behavior therapy, and person-centered therapy. Each one brings a distinct perspective and set of tools to the therapeutic process, and understanding how they differ and when to apply each can be transformative for both you and your clients. First up, let's dive deeper into cognitive behavioral therapy, or CBT. This modality is rooted in the idea that our thoughts, feelings, and behaviors are interconnected. In essence, the way we think about a situation influences how we feel about it and, consequently, how we respond. CBT is structured and goal-oriented, focusing on problem-solving and the modification of unhelpful cognitive distortions. Have you ever caught yourself spiraling into negative thoughts? Maybe you failed an exam or had a tough session with a client. It's easy to let those thoughts amplify our feelings of inadequacy. CBT teaches us to challenge those automatic negative thoughts. A key technique here is cognitive restructuring, where we identify those distorted thoughts, evaluate the evidence for and against them, and then reframe them into a more balanced perspective. For example, instead of thinking, "I'm a terrible therapist because I didn't help my client today," you might reframe that to, "I'm learning and growing as a therapist, and every session is an opportunity for growth." This shift in perspective can lead to healthier emotional responses and more constructive behavior. Now let's transition to dialectical behavior therapy, often referred to as DBT. Originally developed for individuals with borderline personality disorder, DBT has expanded its reach to various populations, emphasizing emotional regulation, interpersonal effectiveness, distress tolerance, and mindfulness. One of the most fascinating aspects of DBT is its focus on the concept of dialectics, which means balancing opposites. In therapy, this could manifest as the balance between acceptance and change. It's not just about pushing for change in a client's life, but also validating their feelings and experiences. Imagine a client who struggles with intense emotional reactions. In a DBT framework, you would first validate their feelings, saying something like, "It's understandable to feel overwhelmed in that situation." Then you would introduce strategies for managing those feelings, like distress tolerance techniques. This dual approach creates a safe space for clients and helps them feel understood while also equipping them with tools to navigate their challenges. Next, let's explore person-centered therapy, which is grounded in the belief that every individual has the capacity for personal growth and healing. Developed by Carl Rogers, this modality emphasizes the importance of the therapeutic relationship, where the therapist provides an environment of unconditional positive regard, empathy, and authenticity. In person-centered therapy, the therapist acts as a facilitator rather than a directive authority. This means you're not there to give solutions or advice, but instead to create a supportive environment where clients can explore their thoughts and feelings at their own pace. This approach fosters self-exploration and discovery, enabling clients to find their solutions. A great example of this is how the therapist might respond to a client expressing anxiety about a job interview. Instead of jumping in with practical tips, the therapist might say, "Tell me more about what you're feeling." This open-ended question invites the client to explore their feelings and thoughts more deeply, potentially uncovering insights that can lead to self-empowerment. Now that we've unpacked these 3 modalities, let's address some common misconceptions that therapists might have about them. One prevalent misconception is that these modalities are mutually exclusive. In reality, many therapists integrate techniques from multiple modalities into their practice. This integrative approach can be quite effective, as it allows you to tailor your therapy to the unique needs of each client. For instance, you might find that a client responds well to the cognitive restructuring techniques of CBT, while also benefiting from the mindfulness practices of DBT. Recognizing that these modalities aren't rigid boxes can empower you to be more flexible and creative in your therapeutic approach. Another misconception is that using a specific modality means adhering to it strictly. While it's essential to have a foundational understanding of each modality, the best therapists are those who adapt their techniques based on the client's needs. Therapy is not a one-size-fits-all process. It's a dynamic and evolving interaction that requires sensitivity to each client's context. So, why does this all matter? Understanding these modalities and how they interrelate can transform not only your practice, but also your clients' experiences. By adopting an integrative approach, you'll be better equipped to meet the diverse needs of your clients, fostering a more effective therapeutic alliance. As we wrap up this episode, let's reflect on a few thought-provoking insights. Therapy is as much an art as it is a science. Mastering various modalities gives you the tools to paint a richer picture of healing for your clients. Each modality offers a unique lens through which to view clients' challenges, and understanding these perspectives can deepen your empathy and effectiveness. I encourage you to explore Therapy Training's course on 3 CE Hours Therapy Modalities. Whether you're looking to enhance your current skills, gain new insights, or simply broaden your understanding, this course provides invaluable resources for mental health professionals. You can find more information and register at therapytrainings.com. As we conclude, remember that every client is on a unique journey. Your role as a therapist is to walk alongside them, equipped with a diverse array of tools and insights. Keep learning, keep growing, and continue making a positive impact in the lives of those you serve. Thank you for joining me today, and until next time, take care.